The percussive movements called deportment are very effective. Loose fingertip hacking. You flick your fingers together like this. We use this a lot in care for the caregiver for doing shoulders. We also go to stiff fingertip hacking like this, where it's a chopping motion. Cupping, it's like you're scooping water out of a creek. Beating sounds terrible, feels wonderful. Keep the wrists nice and loose. And then pounding is like this. And I'll show you that same sequence from this side. So I take the loose fingertip hacking and get right over the top of her shoulder, the trapezius, and then I change it into stiff fingertip hacking. The cupping is really, really good for helping loosen up the thorax in case you get cough or a cold during your pregnancy. This one, the beating, is really, really good for lower back. And then I find the rolling pounding can be done from this angle or rolling it downhill. So this sort of thing you can keep up during contractions. When you do have a contraction, you want to keep everything still and steady with the pressure, but this is very good for relieving lower back. And within the last 2 weeks, it's even more important, and we're within the last couple of days here, so you can really pour on this rolling deportment. And this one is called pounding appropriately. Make a tight grip. If it's too loose, there's not enough cushion on the ulnar border of the hand. You want it nice and tight, and then roll it. How's that pressure, Lisa?
That's great.
Good.